2 choices for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and we're talking about what it is to have care in a private cancer center where we report to you. So what's the difference? Well, I just want to go back to an article that appeared this week in the New York Times talking about the VA scandal. And you remember that many administrators had bonuses that were tied to whether their facilities met patient wait time goals, including the ability to see a doctor within 14 days. Now remember, we promised to see you within one day, one business day. So many facilities could not come close to matching those standards to see a doctor within 2 weeks, and many administrators and patient schedulers manipulated data and used other tactics to make the numbers look better than they were. They threw out patient numbers, they lost it, they put you on a schedule to make you wait 6 months. Well, what happened to those administrators? It's interesting. This is an article from the New York Times this past week written by Richard Opel, Jr., and he wrote, all of the 470 senior executives in the VA received annual ratings in the last 4 years, indicating that they were fully successful in their jobs or even better. Despite the delays in processing disability compensation and problems with veterans' access to the department's sprawling healthcare systems, none of the senior executives at the VA, 470 of them, none of them got one of the 2 possible low ratings, which were minimally satisfactory or unsatisfactory. And in 2013, 80% of the senior executives were rated either outstanding or having exceeded fully successful applications in their job. And 65% of the executives received performance awards, which averaged about $9,000. Wow. You see the difference between a private center that reports to you and the sprawling center that reports to who knows what? We have a call here. Good evening. You're on the radio. It's Dr. Lederman. I'm sorry, I can't hear you. Can you speak up?
Okay, I was asking you if it's cancer the only surgery you deal with?
Yes, we deal only with cancer and brain tumors. We're happy to see patients with cancer or brain tumors, and we also take care of people with lumps, like women with breast lumps that are fearful that it's cancer. But we're a cancer treatment center in Manhattan at 38th and Broadway. No, we don't do scoliosis, sorry. But thank you for calling, and God bless you.
Okay,
bye. So what do you think about that? 470 executives out of 470 executives of the VA were rated fully successful. Is that normal in business that every executive is successful? Asked Representative Congressman Phil Rowe of Tennessee. It's like great inflation, and Representative Ann Cluster, a Democrat of New Hampshire, said it's like Garrison Keillor's fictional Lake Wobegon, where all the children are above average. Now, the VA paid performance awards totaling $4.7 million. So why seek care in a private cancer center? Because we report to you. We don't report to some administrator who's making up numbers. We need to do the right thing for you, whether that's giving you information immediately, reporting on your CAT scans, your MRIs, your PET scans, your blood tests, returning your calls. That's what we do at Radiosurgery New York. I want to talk about another patient who came to us from a big cancer hospital. And many of our patients come from big cancer hospitals. Why? Because when they first are diagnosed with cancer, maybe they don't know how the system works. And then slowly, they see a system elsewhere that they don't particularly like. Now, this man is a 63-year-old Hispanic male, Spanish-speaking, and he had flank pain in 2012. He was found to have kidney cancer at a medium-sized hospital in the boroughs. It was metastatic to adjacent lymph nodes. He had a biopsy that proved that. Then in this other hospital, they removed his kidney, and the cancer came rip-roaring back. Over the last year, he's had 4 different investigational protocols, clinical protocols. Now, what is a clinical protocol? Well, a clinical protocol is a treatment that is not proven. So it's hard to understand why people are happy about getting onto a clinical protocol where the drug company usually is paying the hospital, you're paying the hospital, everyone's paying the hospital, and yet you're getting a treatment that is unproven. Wow, you'd think that if you go on a clinical protocol, rather than being happy, you'd be apprehensive or reluctant. I think those would be better words to use, apprehensive or reluctant, knowing that you're getting a treatment that doesn't have a track record. Anyway, he had 4 different treatment protocols over the last year. None of them worked. The cancer kept growing. He came in 10 days ago, and he was so happy about his clinical protocol because, I guess he didn't know what he was getting. And then I explained to him and his wife and his son what it meant, and what it meant that the cancer kept growing. Just being on a clinical protocol that doesn't work isn't buying you anything. It's costing you. There's toxicity to chemotherapy. There's toxicity to systemic treatment. There's time away from home. There's complications. So he understood by us offering radiosurgery, we have a track record. We've been at this for more than 20 years. Our success in attacking kidney cancer, even in the kidney, for people who don't want to lose their kidney, is about 90%. Dr. Ariel Lederman just had a paper accepted for the treatment of metastatic kidney cancer to the lung. And there with radiosurgery, with our team, the success rate is actually 97%. And this is the chance of controlling the cancer, stopping it, shrinking it, or making it go away for the rest of the patient's life where we aim the beam. So does radiosurgery work for kidney cancer and sarcoma and melanoma and liver cancer and lung cancer and breast? Yeah, and we have data, and we continue to present our data around the world at national and international meetings. This man woke up by having a conversation, which he never would have had over the phone in 60 seconds. But we sat down, spent a lot of time, reviewed all the records, answered all his questions, and he understood why it may be the end of clinical protocols for him, because he wants something that has a better chance of working. I mean, isn't that what everyone wants? Something that's non-invasive, that has a high degree of work, takes a short period of time, has little or no downtime. And you get a report card. When we're done, you get that scan. Like David Wright got his scan, you get your scan. You get a copy of it, you get the reports, and you see what worked. So nothing is being hidden from you. And I want to talk about a sweet Russian woman who comes in with metastatic breast cancer. She just has had about 8 sites treated over the last couple years, and she got a PET scan, and she's got the images, as I said, and she got the answer the same day, like I promised you all. And all the sites we treated are smaller. They're smaller in size, there's less PET uptake. A PET CT scan has 2 aspects. One is the CT, which looks at the shadow, which is the size and shape of the tumor and the body. And the second is the PET part, which is radioactive sugar. And as the cancer dies, it picks up less radioactive sugar, and the radiologist can measure that. So they can give you a measurement from before and after. This woman, I'm reading from her report now, decreased tracer uptake in the supraclavicular area, decreased tracer uptake in the midesophageal tumor, decreased uptake in the lesion of the sternum, decreased uptake in the anterior iliac bone, decreased uptake in the right lower lung, control the tumor in the left lateral back. Isn't that where you want to be, with your tumors getting better, controlled, outpatient, no hospital stay, no injections? If so, give us a call and we sit down and talk about it, and you can decide if that's the avenue you want to go. At worst, it costs you an hour of your time, and at best, it may buy you a treatment that has a high degree of control. So, we're getting close to the time to speak to our sponsor, but just a minute, I want to talk about a woman who called me on Friday. She called from upstate, from the Binghamton area, and she was an older woman. She said she called 2 years ago about a family member, must have been older than her, and she said, I want to come. I want to see you as soon as possible. I said, you can come now. You can come this afternoon. And I said, tell me about what's going on. She said, well, I saw you 2 years ago. I always thought cancer didn't grow much in the elderly. And I said, the job of cancer, unfortunately, is to grow. Cancer wants to grow. Cancer wants to take your life. That's why we fight cancer. We want to knock it out before it knocks you out. So we met with her 2 years ago. We sent her information 2 years ago. And now, finally, 2 years later, she's coming in tomorrow, driving down with her loved one to talk about what we can do to stop, as she said, the cancer in the elderly. I know everyone has a different view of the elderly. If you're 80, maybe that's when you're 95, and when you're 95, that's maybe when you're 105. So that was a term she used. It's not my words. But cancer does grow in babies and children and adults, and even, as she said, in the elderly. So let's try to offer her true options with the best chance of knocking out the cancer and not hurting the patient. And obviously with us, that's what the patient decides when they learn all the options. This is Dr. Lederman. I'm from Radiosurgery New York. We have a private cancer center where we take care of patients with cancer. We do send booklets and DVDs to you if you call us during the work week, Monday through Friday, 9 to 5. Call us at 212-CHOICES. 212-CHOICES. That number is 212-246-4237. You can call. We guarantee we'll see you within one business day. We'd rather that we work harder than you sit at home wondering what's going on. We used to say we're super convenient, but now I like to say that we're not only super convenient, but we're pretty super. If you get your reports as fast as David Wright, I guess Therese Crawley would say that's pretty super. And we're close to most trains, subways, buses, Grand Central, Penn Station, PATH trains, Port Authority. We accept most insurances, Medicare, Medicaid. So we speak to you directly. You won't speak to a machine when you call us or when you contact us. You won't have a student. You'll have a doctor who wants to take care of you. He'll give you a cell phone. You can call day or night if you need. And you'll probably find a fresh breath of care at Radiosurgery New York. We're going to stop for just a moment to hear this news from our sponsor, and we'll be right back.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next. at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.